Hello and welcome to Health Digest, a program that brings you news, analysis, and conversations on issues that concerns your well-being. I'm Ogom Ezedimbu. Our focus today is cancer, a word that still sends fear through many homes, a disease often linked with death, high cost of treatment, and stigma and silence. But later on the program, we'll be speaking with a cancer survivor who will share experience. But first, here's our health news.
On Health News today, MEC Foundation, in partnership with African First Ladies and Ministries of Health, is marking World Cancer Day 2026 by strengthening cancer care capacity across Africa and Asia. The foundation says it has provided 258 oncology scholarships across 34 countries, aimed at addressing one of Africa's most critical health challenges: the shortage of trained cancer specialists and late diagnosis. According to the World Health Organization, Africa records about 1.1 million new cancer cases and nearly 700,000 deaths annually, with mortality rates significantly higher than in other regions due to limited access to care and weak health systems. Speaking on the initiative, CEO of MEC Foundation, Senator Dr. Rasha Kelej, said the program is focused on building sustainable cancer care systems by training local healthcare providers rather than relying on medical tourism. She noted that nearly 2/3 of cancer cases can be successfully treated if diagnosed early, while up to 1/3 can be prevented by reducing exposure to known risk factors. As part of efforts to promote early detection and awareness, MEC Foundation, together with African First Ladies, also launched a children's cancer awareness storybook and animation titled Ray of Hope, designed to educate families and communities on the importance of early warning signs. MEC Foundation says, in total, it has awarded over 2,000 scholarships in 44 critical and undeserved medical specialists to healthcare workers from 52 countries, reinforcing its commitment to equitable and accessible healthcare. The federal government, through the Ministry of Health and Social Welfare, has reaffirmed its unwavering commitment to achieving universal health coverage in Nigeria, with the launch of the Empower Academy Nigeria in Abuja. The coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who officially unveiled the initiative, described it as a strategic national platform designed to accelerate skills development and unlock the country's healthcare value chain.
What we're doing here is world class, and I believe this is just the beginning. And that's why when the president lists the Renewed Hope Agenda, it's not just a political slogan. There's a vision and there is an expectation that there's a different reality that you have to imagine and then walk the path to realize it. Nigerians will see that this vision is real.
Professor Pate explained that Empower Academy Nigeria will be rolled out in phases, starting with a digital learning platform, before expanding into hybrid innovation hubs and permanent world-class training centers in partnership with universities and research institutions. He said the initiative aligns with President Bola Ahmed Tinubu's presidential initiative aimed at repositioning Nigeria as a manufacturing hub while creating quality employment opportunities for young Nigerians.
Nigeria can be a manufacturing hub, can unlock the healthcare value chain, can create jobs, quality jobs, not any job. Because here we're not talking about just jobs, because you can have jobs that are short-term, no progression, not well-paying. Those are not quality jobs. That's not the kind of jobs we're talking about. These are quality jobs to create for the teeming youth of this country.
What we are providing here is practical, accessible skills for industry. Good news, under the arrangement that we have under this partnership, we are providing in the first instance. So this is going to be delivered in 3 phases that Paul is going to demonstrate. But the first phase, which we are launching today, the virtual platform, is going to provide about at least 40 different courses, ready-to-use courses. And Honorable Minister, these courses are going to be free of charge to all Nigerians.
According to the minister, the academy directly addresses Nigeria's shortage of industry-ready professionals, particularly in pharmaceutical, manufacturing, and life sciences. It noted that while many Nigerians possess academic qualification, there remains a significant gap in practical skills required for regulated manufacturing, quality assurance, and regulatory science. Empower Academy, he said, will bridge this gap through a combination of classroom instruction, laboratory practice, mentorship, and factory-style training.
Thank you so much. The program is Health Digest, and hospital corridors across Nigeria. Cancer patients wait, and some hopeful, others afraid. For our guest today, cancer came quietly. 8 years ago, he noticed a small lump. It was painless, easy to ignore, and like many Nigerians, our guest never imagined it could be cancer. By the time it was noticed and sought medical attention, the disease had progressed, leading to months of tests, emotional trauma, and costly treatment. This story is not just about breast cancer. It is about how cancer, in all its forms, continues to thrive on low awareness, misinformation, and late presentation. Our guest today is a breast cancer survivor. And yes, a male breast cancer survivor. And join me to welcome Omonade Jacob Ochuko. Welcome to Health Digest.
Thank you very much. Go.
Well, I think let's begin. How was it for you when you noticed that lump?
Okay.
How did it start?
It started like 8 years ago now, because this is 2026. It started like 8 years ago. I noticed a tiny bean-sized lump on my right breast, and when I did, I actually thought it was my body maybe reacting to something that I ate, so I didn't really pay too much attention to it. I didn't pay too much attention. I just ignored. So years passed by, and in 2023, my kid's sister was actually, it was her traditional marriage. So she's a doctor. She's actually a pediatrician. So I had to show it to her, and I was like, what's this? And she said that she doesn't really know, but that I should make out time to carry out investigations on it and know what that was. And that was how it all happened. And in 2024, that was around March. That was when I was getting dressed for work in the morning, and my wife noticed that bean-sized lump was increasing in size, and it already had these black patches around, the surface where it was. So that was where I actually got really scared, and I had to, move and start finding out what was the problem. And I had to go to a national hospital where I started from the SOPD. No, I started from GOPD, and I was sent to SOPD, which was the surgical wing. And after that was done, I was now referred to the oncology unit. And that was where I had to undergo the image-guided biopsy, the CT scans. I did CT scans like a whole lot of times, because of the time delay, due to the whole system, the shortcomings, that are there in the system. It actually contributed a whole lot why I had to now go back and now start it. And also the crowd, of people that are fighting a cancer, you will not believe it, not unless you're there. So there's a whole lot, that needs to be done about it. I've had the 6 cycles of chemotherapy, and I've also had a semi-bilateral mastectomy, which is one of the right breast completely taken off, and the other one they just had to take out some tissues to prevent the spread from this wing from this side to the other side.
Your issue was more like late presentation.
Yes.
And you made mention of the fact that even your sister, who happens to be a doctor,
she couldn't tell what it was.
So how much of ignorance and misinformation would you say that contributes to all of this?
Okay, now let's do it this way. If I had known 8 years ago, when it was that tiny bean-sized lump, they would have removed it, and that would have been over for me. It would have been done. Now, I was not aware. Yes, I've known of breast cancer, but it has always been attributed to women. So I never thought, I never imagined in my life. So when I was at the hospital and we were undergoing this test, my hope was that it was going to be one lump, and they would just say, oh, it's something, okay, just have to do a minor surgery and just take it out and maybe take some medications, and that will be it. But that wasn't it. So when it came to me like something I never imagined could ever happen. And it was due to the fact that the awareness for male breast cancer is very, very poor. We are getting there. We are getting there because this has also given me a new mission. A new mission right now, because I have been there. I've seen it. I've seen the pain. I've seen the stigmatization. I've seen, there's a whole lot.
Do you have a family history? Is anybody in your family that has cancer?
Now, that is what my oncologist said. She said that because I asked her, I was like, so what's the cause of this? And she said, it could be lifestyle, and it could also be hereditary. And I was like, I've never heard of any uncle of mine or anybody in my family, maternal and paternal side, that actually had cancer of any type. So she now said that, okay, my brother, let me let you know this, that say that to your knowledge, you understand me? To your knowledge. And I got the point why she said to your knowledge, because if you really get to look at it, even when there was internet and all of that, I did not know about that. Then talk more of, I've had a couple of uncles that are late, not like they were aged, they were not aged, they were young people, 50-something, 60-something, like that. So I really do not know if it was even part of it that contributed, because they are not aware, so they didn't do all this that I did. They didn't go to all of the length that I went through. So I believe that the ignorance is very high. Mostly when it comes to the male breast cancer part of it, the ignorance is very, very high. And I can tell you that when I was sourcing for funds, for the first round of treatment that I had, when I was sourcing for funds, it's massive. So I had to go asking for help from friends, and stuff like that. And I know a lot of them that didn't really take me serious. And also, a lot of people just believe that once you're diagnosed with cancer, it means that you are marked for death. So a lot of them just feel that, why do I need to help? Why do I need to? He go still die. So waiting be the need. What's the? You understand? So it's like, to them, it's like I'm wasting my money. But this is one thing. Let me just say this. I have a song right now that I did. Okay, it's called "Stay Strong." Okay, but it's for cancer. It's a song about cancer. It talks about, it says, cancer no be death sentence, okay? Cancer is not a death sentence. That is the message I want to send with the song. That cancer is not a death sentence. So when you hear that someone has cancer, please, if you can help. if organizations that are there that can be of help, let them help. And if you well-meaning Nigerians and worldwide individuals that can actually help, if they can help, let them help. Let them not just rule people out and say, oh, it's over.
And during your visit at the hospital,
Okay.
did you notice any other male breast cancer patient?
Okay. Now, coming to that, a lot of the people at the National Hospital, guess what, at the oncology wing. Now, let me tell you something. When I was to go for my first chemotherapy, when I was to start, and I was to go through the whole registering process for me to be admitted and giving a bed for the chemotherapy to be administered at the oncology wing. And the lady that was in front of me, my wife was standing behind me, and she said, sir, what are we managing you for? And I said, breast cancer. And she laughed. yeah, she laughed. She chuckled, and she was like, sir, be serious now. Please, where's your wife? And I told her, I was upset because it was like, to me, that's the stigmatization that we're talking about. You know, it was funny to her. So she didn't really see it as, yes, because she's never seen anybody.
Yes.
So I was the first, and I am the first that a lot of people are using to know, because during my treatment, the whole thing about it is that we need to create more awareness, mostly on this male breast cancer. Mostly on this male breast cancer. And if I have to be sincere with you, that is the new me. I want to do everything that I can. I was at the Medicaid cancer walk, and I spoke to the crowd that was there. And I told them, I said, I did not hide my face because I want to be able to let people know so that they don't go through what I went through. The ignorance that I suffered that brought me to this point, let them not go through it. And that is why I am on a mission. It is called, it starts with a lump. You know, it starts with a lump. It's a project that I'm embarking on right now, and I need all the help that I can get.
It starts with a lump.
Yes.
Let's see. Outside that lump, did you find any other early warning signs?
Nope. It was that lump that for male, even with the female, I'm not very, very vast about their own aspect of it, but for mine, I have done a lot of research. And my wife right now, I will consider her an oncologist that did not go to a medical school, because she has done a whole lot in trying to just fight for me. You get that? So there is no other sign. Mostly when it comes to the breast cancer, it is that lump. That's why I tagged this project. It all starts with a lump. And the aim of it is I want to go into the villages, those parts of where they don't have internet, where they are not even aware, where they don't even know. Because the people that have internet on their phone, you are here. I'm sure that maybe I'm the first male that you're seeing, right? So they are not even aware. So how do you expect these people in the villages, how are they supposed to know? So that is where I want to focus on. I want to focus on those interior parts. I want to go there. I want to speak with them. I want to show them the scar on my chest of the mastectomy that I have. I want to show them and let them. I want to be a typical picture, an example, something that you can't run away from.
You are a survivor, and we still have people who are battling this disease.
Yeah.
What is funding like?
Okay. The first round of treatment that I've had so far, I spent 17 point something million.
Are you still on treatment?
Yes.
Okay.
Yes. The first round of treatment that I've had, I spent over 17 million naira.
17?
Yes, 17 million. Because each of my chemotherapy cycle was 2.450. Because the drug that I was using is called Phesgo. And Phesgo is very, very expensive. My oncologist said, when she gave me my treatment plan, and we were thinking about what is the cheapest or what is the alternative, she directly told me, she said, Jacob, we don't have any other one. Male breast cancer can be very, very aggressive. And the very type that you have is the aggressive type. So we need to apply an aggressive approach. And that was what we did. But even with all those aggressive approach that we did, it was after I had the mastectomy and all that, I had to go for another CT scan. And after that, she sent me to a private lab where they had to do the comparison of the first one and the last one that I did now to know the extent of how the chemotherapy worked and all of that. So we did all that. And when the result came back, after the last CT scan that I did, she now saw that it has spread to my lungs and my liver. So I have to go back to systemic treatment again, which is the chemotherapy, and which is not cheap again. So right now, I've not even started. I was supposed to have started since July, September. I was supposed to have started, but I haven't started because the finance is not there. So right now, I don't even know the present state of it. And cancer is one thing, they're not like malaria. You waste time, it's a problem.
It keeps growing.
It keeps growing. And once you start addressing it, it's like it gets more aggressive. It gets more aggressive. So
are you under NHIS?
Yes. No, I'm not under NHIS, but okay. I am one of those that benefited from the NICRAT CHF.
Okay.
Though it wasn't enough, it couldn't really, what I was giving, it can't even do me 2 cycles of chemotherapy. So
there's a kind of improvement when it comes to cancer fund? Is that what you're saying?
Yes, the CHF is actually trying. I would say that because I know that a lot of people right now that I know at the National Hospital, I know a lot of them that are actually benefiting from the CHF fund, but it's just that it's not enough.
How is it like at the clinic where you went to have your own treatment in terms of infrastructure and all the machines that is needed to attend to this number of people?
The National Hospital Abuja, yes, they are trying to have machines and all of that, but they need more because the machines can't even take the inflow of people. They can't take them. So you can book an appointment for CT scan and you are given 2 weeks to come back. 2 weeks for cancer person when it be say with each second, you need to be attended to. You get me? So that's how it is there. And also, I would say that they need to do a lot for all this. This whole, I see on the news they're talking about setting up new cancer centers and all of that. The hospital, they need to be well funded. These appliances, these machines need to be there. And they need to have enough of it. I know that these machines they are not cheap, but we have the resources. Let the government put more attention and also put people that actually have the heart to do the job, not just mouth makers, okay? Not just talk. People that actually want to see people survive cancer. Those are the kind of people that we need, not the talking types.
All right, Jacob, before I let you go, I just want you to give a message of hope, Okay. What's that key message you want to pass to Nigerians in terms of awareness, early detection, to patients, to families who are going through a difficult moment at this time?
Okay. If you are a cancer patient and you are out there and you are watching this or you're hearing this, I need you to know that, number one, first of all, your state of mind is a key factor. Early detection is key. But guess what? The early detection that we talk about, mostly for the breast cancer thing, a lot of, women, they have lumps and they have breast, and sometimes they really cannot detect which one. But if you are a woman and you are constantly checking yourself, you will know when something strange has emerged. Then for a man, that, you see, My message mostly is for the men, because they all think that I'm a man, I don't have breasts. Bros, Baba, let me come down to to the street level. Bros, we get breasts. Now say our breast not big like woman own. We get tissue for there too. Only say women get more tissues when it be say they bring out all those milk for children and they do all those things. That is the difference. You get breast, bros. My brother, you have a breast. Every man have a breast. That's why we have nipple. If you no get breast, you no go get nipple. So you have nipple there. So for the fact that you have that, check your breast. If you find, mostly for a man, you are not supposed to have any form of lump in your breast if you are a man. So if you find any tiny bean-sized lump, go to the nearest hospital where they can carry out a diagnosis for you and find out if it's just a normal lymph node that is there or if it is a cancerous one. Go and find out. Go and find out. The state of mind matters a lot. What you think about, the form, whether you entertain fear and all of that. See, let them see. Stay Strong is going to be online. Is going to be online. Go and download the song and listen. Everything that I said in the song they were everything that I went through. They were everything that every cancer, breast cancer, male, woman, what they go through is what is in the song. So go listen to the song and hear it for yourself.
Thank you so much. Up next on the program is our healthy living tips.
Water helps the body in many important ways. First, it regulates body temperature. When we sweat, water helps cool the body, especially in hot weather like we experience in many parts of Nigeria. Without enough water, the body struggles to maintain a safe temperature. Secondly, water supports digestion and nutrient absorption. It helps break down food, prevents constipation, and allows nutrients to move easily through the bloodstream to different parts of the body. Here are some simple tips to stay hydrated. Start your day with a glass of water. Carry a water bottle when leaving your home. Drink water before you feel thirsty. Reduce sugary drinks and replace them with water. In a world where many people focus on supplements and medication, we must remember that one of the most powerful health tools is simple, affordable, and accessible water.
And that's our package today. Thank you for being a part of Health Digest. Remember, early detection is key. Ensure you go for screening. If you notice any changes in your body, please see a medical doctor. Do not self-medicate. Don't go to the clinic and say, give me this, give me that. No way. Please see a doctor. And at the end of the day, we'll all be successful. That's our package. My name is Ogom Ezedimbo. Stay safe.